Hi there, Dr. Cary, Yurkiw here. Today I'm talking about taping the ankle after an injury. And when patients come into the clinic, they have an ankle injury. Usually it's from twisting their ankle. And then I'm going to talk to you about how I tape it and how I treat ankle sprains and strains. Now, usually what I see is the person coming into the clinic with a twisted ankle. They roll on the outside part of their foot, and this is called an inversion sprain. It stretches these retinacula, which are coverings that keep everything together, and then it does pull on the tendons and stretch the ligaments, sometimes making them looser, and then they can't hold the bones together. We often see misalignments of the ankle bones. So as a chiropractor, we want to adjust the bones, realign them, improve the function of the ankle bones, and then get the tissues to heal around the ankle. One of the things I like to do is taping the ankle and following these retinacula that are naturally present. This is like the body's tape, actually. So we're going to replace the tape with some outside tape to help it heal quicker. And what I like to do is take the KT tape, which I'll show you in a minute, and then wrap it around the ankle like this, one strand around, one behind the heel like that, and one around the top of the foot. So we want to do a wrap around, and we want to do that as much as possible with one strand. Sometimes we need two strands to do this, but you'll see in a minute I'll pull the strands really tight and then stretch them out as far as I can, going around the foot this way and then around that way, just to give it that extra support where those retinacula are naturally present in the foot. Now, sometimes I'll run a strand down the outer part of the shin, going down into the foot. This one's going straight down. I'll try to angle it a little bit more, following the tendon on the outside part of the leg going into the ankle. So what I like to do is follow this muscle group, this tendon that goes down and to the side of the foot, mid-foot. So I kind of follow that line right there first. Then I tape around this way, tape around this way, and one going around the back part of the heel and the foot. So that's what my goal is, to get those three tape lines on the ankle. Now, what does it look like? The KT tape comes in a package like this, and then it comes in a roll like this, and the roll has strands in it. So it comes like this, and then you can tear off a strand just like that from the roll. Now this strand has some backing on it right there. And what I like to do is I like to tear the backing. I just kind of tear into it just like this and pull the backing apart so it has two pieces like that. Right? And then what I'll do is I'll pull those two pieces apart, kind of give it some space so I can attach this sticky part onto the point on the foot where I want to start. Kind of the mid part of the strand is what should be applied first. Then I like to stretch it out. So I'll put some stretching or tensile strength on the band, stretching it out. Take this KT tape backing to its maximum, stretch it out, and then apply that. And then at the end, I'll take the backing off. It'll be stuck onto the skin, and then I'll work on the other side, stretching that out to the end point, pulling on the tape, and then applying it on the other side of the foot. And then that'll be stuck on at the maximum stretchability, and it'll contract naturally to give the ankle some extra support. So that's kind of how I like to tape the ankle, is to follow the natural tendon alignment and the retinaculum, which are those bands that are naturally present around the tendons and the bones. And then that way it'll give it the maximum strength and stability to support the foot, especially when the patient first starts to walk and use their ankle. That's when we need the KT tape the most. So it's assessment, adjustments for the ankle bones, then it's the KT tape. Sometimes I'll use laser or shockwave to help the tissues to heal faster, and our goal is to get 100% range of motion and 100% alignment restored so that it was like the injury never happened. If you're in the Kelowna area, you need help, please call the number below. You can also go online to book an appointment. If you're a patient of mine, you have any questions about KT taping, ask me at the next appointment. If you're not a patient of mine, you can leave a comment below or DM me. I'd be happy to help you.